Well, it's spring, and with that comes allergy season. The coughing, the sneezing, the reaching for the allergy medicine. And in most cases, these antihistamines are cheap and easy to buy. And depending on your symptoms, you might find you or your child is taking them quite often. But overusing these drugs can have some dangerous effects. So we turn now to Dr. Christina Domansky, a toxicologist at UT Southwestern Medical Center, to talk about antihistamine abuse. Thank you so much for joining us this afternoon. So you were telling me just before in the commercial break that this is actually something you see happening quite a bit, antihistamine abuse.
We do. Teens get hold of it and they use it recreationally or to get high with.
And when they're using it, what exactly physically is happening to their bodies?
The most obvious thing we see is hallucinations, and that's why they go for it, because this drug taken in excess can and does cause hallucinations.
And when they take too much of it, what sort of damaging effects then will happen to their body? I would imagine respiratory, maybe even liver. Your body's being affected when you're using this drug in the way it's not supposed to be used, right?
They do. People can get very agitated if they're hallucinating and seeing things that are not there, and as a result can put themselves in dangerous situations. We also see things like rapid heart rate, abnormal heart rhythms, in very severe cases, seizures.
And seizures. Wow. And would this be permanent damage, or is this something that folks can recover from if they end up taking too much?
If somebody comes to the hospital in an appropriate amount of time and gets good medical care, it can be recovered. Very severe overdoses can have bad outcomes, though.
Obviously, if you're having hallucinations, you know you may have taken too much, but are there any symptoms at least parents can sort of look out for with their teens or children to know maybe their child isn't using this medicine the way it's supposed to be used?
Generally, if somebody is intoxicated with it, it's pretty obvious. The person's seeing things that are not there. They may be agitated, walking around confused. They may have a dry mouth and a rapid heart rate. Other things to watch out for would be if your child is buying a lot of these, if you're seeing packets in the trash, just general common sense things at home.
And maybe for the folks who are just desperate for relief, but the medication isn't working, so they end up using too much. When, in your opinion, is it time to maybe see an allergist or a specialist when it comes to trying to take care of your allergies?
If your allergies are uncontrolled with over-the-counter medication, that's when I would see an allergist.
Okay.
If you're concerned you've taken too much of the antihistamine or you're having side effects that are concerning you, I would talk to your doctor or call us at the Poison Center. We'll be able to help you out.
Okay, Dr. Domansky with UT Southwestern, thank you so much for joining us this afternoon. Appreciate it.